Okay, so what we're going to do is we're going to have an overview of labour and birth. So we're going to go through these images and just explain exactly what needs to happen inside your body, what your body does, what your baby does, just to give a bit more of a basic understanding, really, of what labour and birth involves. So this image that you're seeing now is the end of pregnancy. So there's no labour or birth happening. This is waiting for labour to start, if you like. So let's just talk through what's happening. So this is the cervix here. It's long and it's closed. Bladder, which is not holding a lot. So, but your baby's taking up all this space. So remember that for later. Pubic bone, bit of pressure there because your pelvis is expanding to accommodate your baby. There's birth canal there. There's your back passage as well, which will become important later on. So, and there's your spine. Baby's got his chin tucked in. So this part of the head here can put even pressure on the cervix, which can help it to dilate. The umbilical cord's there and the placenta's kind of at the top there. So at the end of pregnancy, this is when some women will experience quite regular Braxton Hicks. You can start to experience different niggles, I would say. So lower backache, maybe a bit of cramping, things that can make you think maybe something's starting to change, maybe something's a bit different. There could be just a different level of new discomfort there, perhaps. Now, at some point, the cervix will start to change. So it will start to soften and it will start to thin. The Braxton Hicks that you're having can start to encourage some of that movement to happen. And what happens when the cervix starts to change as the mucus plug will start to come away? That can mean different things for everybody. So it can just mean a little bit of extra discharge, or there can be kind of noticeable mucus and jelly, which will increase the more you dilate. And it can be quite bloody as well. So if there is any blood that kind of alarms you, just you can just quite simply get that checked out. But chances are it's just part of the mucus plug. So this isn't labour yet. This is just the beginnings of all of this happening. So there will be some contractions, but they could be very unnoticeable, very mild. This is definitely a place for, is this labour, is this not labour, with kind of these new sensations and this new discomfort that's going on. Now, the cervix is about 1 centimetre dilated in this image, so this is the very beginnings of early labour. Depending on how your labour unfolds and depending on the position of your baby, this could be short to the point. You could be in established labour quite quickly, or this could just rumble on over several hours, possibly into days. If it's taking a while, chances are your baby is just not quite in the right position, and those contractions, rather than dilating, are doing they're doing the maneuvering of your baby. They're getting your baby lined up into a better position for labour. And the pattern of your contractions can vary. So for some women, they are kind of very textbook. They're getting closer together. They're noticeable. There's a noticeable pattern between contraction and a pause in between. For other women, they can be all over the place. There's no distinguishable pattern at this stage. They can be irregular, they're short. Some can feel quite intense, others very mild. Typically, at this point, you are alert, chatty, very present in the room. So if I attend a birth, if I go to somebody's house and I'm judging where they are in labour, whether I'm staying as a doula, whether I'm going home for a bit, it's about kind of how chatty and engaged they are. As labour intensifies, typically the chat tends to stop. It tends to be less about conversations and more about, there's a sense of urgency. It's kind of, they don't really want to be talking. So that's just a real general guide as to where you are in labour. So here the cervix is about 4 centimetres, which medically is the beginning of labour. These contractions will most probably becoming more regular now, more distinct, but the pattern will still be unique to you and your baby. So you could have contractions that, again, very textbook, that are getting closer together. And for others, they might still be staying 5-6 minutes apart, but the intensity of them is what's building. You can only go with what your body's asking of you. So you can't force the pace of your labour to change. You could still be quite alert and chatty at this point, but gradually becoming kind of more focused. And chances are, as contractions intensify, you won't talk through your contractions. They will be demanding your focus. So for some women, they will go to hospital at this point, because either because things feel quite intense and it feels like the right time, or sometimes it's because maybe fear takes over a bit and you know something's changing, these are intensifying, and you don't feel that comfortable being at home for as long. So the important thing is to go in when it feels right for you. So for some women, they'll go into hospital after this point. Labour's about hormones and a fine balance of hormones. That's what makes it work. So you need oxytocin, which creates those really strong, powerful contractions. And then matched with that is your endorphins, which is your own natural pain relief. And that has a similar makeup to an opiate. So it kind of does take the edge off those contractions. However, in labour, if you're feeling too, maybe a bit too overwhelmed, a bit stressed, panicky, tense, like really holding on to tension, then chances are that will slow down your labour. Those contractions won't be as effective as they could be. Progress may well slow, and those contractions could be more painful and harder to work with. If you can move, be as comfortable as possible, and so importantly, feel safe so that your oxytocin can really kick in and do its job, that's when labour kind of can work quite well and labour progresses. Anything that inhibits all of that kind of gets in the way. So the environment that you're in, the support that you have, that's what helps this balance of hormones to work as well as it absolutely can. Now, at some point, you're going to be almost fully dilated. So this is what we call transition. And what's going on here is that there's a bit of a jumble of hormones going on. So what happens when you're in strong labour is you kind of go into labour mode and you switch off your engagement with the room. So you're totally focused on contractions and what feels right for you. So something could be going on in the room and you just don't care. You're not interested at all. However, at this point, what happens is that the zoning out and the focus that you've had starts to shift. Because from a physiological perspective, your body wants you to be more alert for the birth of your baby. So for some women, they really then become aware of the contractions, aware of the pain, aware of how they're feeling, and kind of fear can kick in at this point. It's really normal and typical for a woman who hasn't had an epidural, say. So her hormones are doing their thing. She's zoned out. She's working with contractions, and then round about this point starts to emerge from that zoning out, and then starts to say, I can't do this anymore. I don't want to do this anymore. I want all the drugs. Take me for a cesarean. This is enough. Midwives listen for that. As a doula, I listen for that. And it's really typical because I know that the hormones are shifting at this point. So for a birth partner, it's about calm, refocus, work with these contractions, and then very soon you're probably going to get that urge to push. It's called transition because you're moving from labor to birth, and those contractions are going to start to do different things. So in labor, these muscles of the uterus here have been shortening. That's what creates this cervix to dilate. What's going to start happening during birth is that these muscles, where they've become thicker at the top here, are going to start pushing down and guiding your baby out through the birth canal. So things are starting to alter. When you're fully dilated, all that means is your baby can leave the womb. So what also happens, and gravity will help this, is your baby needs to start to turn to face the spine. And that's because there's a little bit of a dance that needs to be done to slot through the pelvis. The dimensions of the pelvis mean that a baby has to change position. Now, what's important with this is that a baby's lined up in a good way. So sometimes if labor doesn't progress past this point, it's because in labor they weren't quite in the right position to enter the pelvis in order to do this maneuvering. Things that can impact that are if your bladder's full as well, because if you imagine if this bladder's full, that takes up space that your baby needs to move into a better position. So emptying the bladder can help, change of position can help just to maximize the space in there. Now, what you'll also notice in this image is the waters are still intact as well. And this is something else that's very typical. So the waters tend to break the further into labor you are, or when you're at this point, which is birth, and you're pushing a baby's moving down through the pelvis. So the contractions at this point, again, could be about a minute long. They could go back to being 3 to 5 minutes apart. And as you can see, the waters have broken at this point as well. Being upright, having gravity is going to maximize the space in your pelvis, and you might need support depending on how long labor's been to be in a more upright position. Now, those contractions are going to nudge your baby down through the birth canal. If this is your first baby, this will take longer than if it's a second or subsequent baby. So you can see how your baby's head needs to stretch. And that's why the plates on your baby's head are not fused together so they can move and they can stretch in this way. And you will feel different pressure. So there will be pressure on your back passage. Now, at this point as well, you can see there is a lot of pressure here. So this is where sometimes women will start to maybe have a bowel movement. It's not truly a bowel movement. It's just if there's anything in this lower back passage, the pressure is going to push that out. baby's head at some point will start to become visible. Now, what's going to happen though is this is during a contraction. So these muscles are pushing down on your baby to guide your baby down. When the contractions finished, these muscles are going to relax, so your baby will slip back a little way. If you're upright, your baby will pretty much sit there in that position. If you're lying down, however, this is a bit of a U-bend. So for some babies, your baby's head becomes visible and then it slips back and then it's not. So you're kind of working against gravity. So it can be useful to kind of think about positioning at this point as well. Now, this is crowning. Baby's not slipping back anymore. There's enough of baby's head visible that baby's absolutely on his way out. Now, when you start to feel the stretching of your perineum, this can be a panic point because we don't want to tear. And I think the reality of kind of pushing a baby out of your body hits home. But this is a point in which to really focus on your breathing, really slow it down. So on TV, this would be panting. If that works for you, great. I tend to think about it with birthday candles. So your deep breath in, and then it's just really slow, short out breaths, just to allow the tissue of your perineum to stretch more gently to accommodate your baby's head. And then just keep focusing on your breathing until your baby's head is out. And that gives a lot of relief at this point, even though, the rest of baby is to come. And then baby needs to do some turning because there just needs to be a last twist just to birth the shoulders. First shoulder, and then baby will keep on twisting, and then the second shoulder, and then your baby will be born, and baby will slip out at that point. The things to remember about this are there is not a right length of labour to aim for. It will be what it will be. Say what you need, whether that's more pain relief, whether that's to discuss your options. You are at the centre of this. If you need more information because labour feels longer or a lot quicker than you'd expected, that's fine. That's what your midwife's there for. That's what your doula's there for if you have one. Having that support so you can feel safe really does make that bit of a difference. There isn't a typical pattern of labour. There isn't a typical pattern of contractions. You and this baby have never ever happened before. So while there's common features that we look for and expect, it varies. Every labour I'm at is completely different. There are commonalities, but there are also huge variations. And that's what your team's there to support and to give you that understanding of, so that you can make the decisions that feel right for you, and so that they can work with you, so that you can be as calm as possible. As you go through all of this, make notes, write down your questions, and then let's build that birth plan. And then let's build those strategies for maybe what you need and what's gonna get you through labour and birth, and then meeting your baby.